If you have lymphedema, then you have surely been educated on skincare and the risk of infection. But maybe you do everything you're supposed to do, but are one of the many patients that experience recurrent infections in your swollen limb. Despite your best efforts, wearing your garment, bandaging, self-MLD, using your pump, meticulous skincare, exercise, elevation, and all the things, here are some more recommendations that you need to know about in order to keep yourself as safe as possible. My name is Lisa Berman Sylvestri. I'm a physical therapist and a certified lymphedema therapist, and my goal is to keep us all lymph smart. Cellulitis is the most common type of infection that occurs in swollen limbs, but it's also sometimes called lymphangitis or erysipelas. And while these are often put into the same category because they're all bacterial infections, there are some subtle differences that I think you should know. They're all primarily caused by the streptococcal bacteria, but may be caused by other bacteria as well. Cellulitis typically affects the deeper soft tissue, while erysipelas usually involves the more superficial tissue and skin layers. Lymphangitis is typically characterized by the occurrence of an inflammatory streak of the superficial vessel itself with no inflammatory spreading lesion. Differentiation of these infections can only be done through wound or fluid cultures, as they may also all present with systemic symptoms such as fever, pain, and redness. These infections thrive in the protein-rich environment that is seen in lymphedema. And because of the increased diffusion difference, because of the swelling that's in the soft tissue that occurs with this chronic swelling, it's much more difficult for the proper nutrition to reach the skin and also to eliminate any bacteria that might get into a tiny opening in the skin itself. So infections can turn dangerous quickly, and they damage our lymphatics by putting down more scar tissue, which becomes fibrosis, which can create this vicious cycle over time. It's estimated that a patient with lymphedema has about a 25% risk of experiencing at least one cellulitis infection in his or her life. And for patients who get one infection, the risk of recurrence of cellulitis or erysipelas is greater than 50% within a year of the first episode in patients with lymphedema. So despite your best efforts to reduce edema and practice meticulous skincare, plus taking antibiotics when you do get an infection, there are just some people who get these recurrent infections over and over. And here are some things that you can do to try and minimize your risk for these recurrent infections. 1, make sure you take the full course of your prescribed medications. Many infections that don't get better are usually because you start feeling better and stop the medication, or you were never given the right dosage to begin with. Most times, a full course of 10 to 14 days of medication is recommended versus a shorter course of medication. Number 2, manage your weight. Obesity is a known risk factor for the development of cellulitis and for progressing lymphedema and decreasing lymphatic drainage. So stay on track with your diet even when you're on medications and your stomach may not be feeling so well. Penicillin is optimally the medication of choice for streptococcal bacterial infections. It has been successfully prescribed for chronic episodes of infection as well, and it can be used preventatively for future infections. If penicillin isn't possible, there are other medications that may be used, and other drugs may be appropriate if the infection doesn't clear with an initial course or another type of bacteria has been cultured. Prophylactic medication should try to be stopped at about 1 year, but this can be extended if you discuss this with your personal medical team and are being monitored. Upon completion of medication, if your swollen limb has worsened, a complete course of complete decongestive therapy is recommended. Surgical techniques may now also be recommended for patients with a history of recurrent infections, so a referral to a lymphedema surgeon is appropriate. This table of antibiotic recommendations comes directly from the British Lymphology Society, and it's the guidelines for the management of cellulitis and lymphedema. Please read this, download it, share it with your medical team, and use it for future reference on how to best treat cellulitis infections. Continue to always do your best to manage your swelling and lymphedema, minimize your infection risk, and maximize your health and performance. I hope this information has been useful. Please like, share, and subscribe to keep up to date and to stay lymph smart.